Hello, everyone. Happy evening. A very good evening. I hope and I believe all of you are doing well. Am I audible and visible? A quick nod. I cannot see the audio visual. Am I audible and visible, guys? Just give me a minute. I'm not able to see my video and audio. Meena, I should be taking that as a compliment. I just wish that I could also see you guys as well. Uh, okay. All right. So happy evening, everyone. A very good evening and welcome to the today's YouTube live session where it is your anatomy binge revision. So now if you have this question that this is the session where, you watch this and the entire anatomy would be covered. It's not like that, but actually it is the most important topics according to me, and where we generally tend to make mistake, those minor areas, where I do not want you to make mistake. That is what we are going to cover in the today's session. बेंच रिवीजन हर सब्जेक्ट का होगा सोचा तो बहुत कुछ है राइट वी थिंक अ लॉट ऑफ थिंग्स बट हाउ मेनी ऑफ इट वी वुड बी एबल टू इम्प्लीमेंट दैट वी हैव टू सी ओके वैभव ओके आई कैन अंडरस्टैंड गुजराती बट आई एम नॉट वेरी गुड विथ स्पीकिंग दैट ठीक है डॉक्टर निशा आई नीड टू हियर दैट सॉन्ग ऐसे तो मुझे समझ में नहीं आ रहा कोई बात नहीं थैंक यू सो मच फॉर दैट डेडिकेशन एनीवेज सो NEET PG 22 Anatomy LMR, is it only NEET PG? It is for FMG students also. So I'm going to cover some important topics. As I said, it's a mixed bag of topics. So actually the plan that is going on the, on the platform basically is, I'm sorry. So we have 7 a.m., then we have 10 a.m., then we have 5 p.m., then we have 9 p.m. that is going on. 7 a.m. is study with me session, the productive part to kickstart the day where you study, I study, you see me studying, and I think that gives you motivation to study basically. So that's how it is. It's no teaching there basically. It's just study with me session, a virtual library, right? So if you go to a library and you see someone studying, right, that motivates you. So that's what is the concept. 10 a.m. Is the Unacademy Plus class that is going on, the radiology revision. Tomorrow we have musculoskeletal radiology and OBGY radiology for all the Unacademy Plus subscribers. Radiology revision is going on. 5 p.m. is the KBMD, Kaun Banega MD live quiz. Today we did top 10 mnemonics, so tomorrow it would be fast 5 clinical questions. All of these are important. KBMDs are a must visit sessions. They are live quizzes and these are free classes basically. And 9 p.m. is according to the subject target that is going on in the timetable, the 35 days timetable that we have. So today I hope you are completing your anatomy. Tomorrow, one day target, it is gonna be orthopedics, right? It's your ortho that you have to complete for tomorrow. Okay. So tomorrow 9 p.m. we plan the ortho rapid revision, whatever we can do. The most important, right? Something is always better than nothing. So starting with anatomy revision here, most important, the neural crest derivatives. Okay, so we have mixed bag topics. So get ready for this. Study with me morning session till exam. I'll definitely try to do that. As I said, provided I don't have any other commitments, I'm not out of the home. I'll definitely do it, right? It's something which even I look forward to because I'm very productive during that time. Chalo. So neural crest derivatives, what is the mnemonic? This is very important. Get to hear some background noise also, but I think that's fine. Okay. The neural crest derivatives, the mnemonic is MPSC goal. Okay, the mnemonic is MPSC goal. So crest is like the mountain peak, right? So the mountain peak cracking the MPSC exam, like you have UPSC, there is MPSC also. So cracking the MPSC exam, the goal of cracking the MPSC exam is like climbing up the crest. Remember neural crest derivatives, it is MPSC goal. What does it stand for? The melanoblast or the melanocytes. Remember, except your retinal pigment epithelium, which does not come from the neural crest. From where does your retinal pigment epithelium comes? From where does the retinal pigment epithelium comes? I'm waiting for the answers. From where does the retinal pigment epithelium is derived from? I hope okay. Yes, that is the neuroectoderm. Okay, that is the neuroectoderm from where it comes. I hope you guys are able to see the slide. If not, please do it full screen so that you can see it right in the landscape mode. You'll see it better. So neuroectoderm. Then you have MP, that is parafollicular C cells of thyroid. Then you have the Schwann cells and the satellite glial cells, right? Very important. And then you have the C, which is the conotruncal septum, which is there, which is the connective tissue and bones of the face and skull. All this is the neural crest. Then you have the G, that is ganglions. You have O, odontoblast. You have A, that is adrenal medulla. And we have L, which is basically leptomeninges. Leptomeninges is your arachnoid and pia mater. Please remember in the meninges, okay, in the meninges, what do we have? Uh, in the meninges, basically your dura mater, then you have the arachnoid, and then you have the pia mater. What is the dura mater derived from? आज का पीडीएफ आइडियली मेरे को अभी शेयर कर देना चाहिए था, बट कोई बात नहीं, मैं आफ्टर द सेशन आई विल डू इट. Dura mater, remember, is derived from mesoderm, and arachnoid and pia mater is derived from the neural crest cell. So you can remember this as well as MD cap. Getting a MD degree is like, or getting into MD is like a feather in your cap, another feather in your cap. So remember that mesoderm is dura mater, okay? Mesoderm is dura mater, and the crest cells is basically your arachnoid and pia mater. Okay, very, very important. Adrenal medulla is from the crest. Okay, another mnemonic here. So you're gonna revise a lot of mnemonics here basically. So adrenal medulla is from the neural crest cells. Adrenal cortex is derived from the mesoderm. Okay, cortex is derived from the mesoderm. So basically remember, M is for C and C is for M. That is, medulla is from the crest cells and cortex is from the mesoderm. Okay, cortex is from the mesoderm. All right. So everybody is clear with this, the derivatives of the neural crest cell. It is your MPSC goal. The melanocytes, parafollicular C cells, Schwann cells, satellite glial cells. Then you have your connective tissue, bones of the face and skull. Please remember that. Conotruncal septum in the heart, very important. Then you have your G, that is the ganglia, then your odontoblast, that is dentine, and your adrenal medulla and the leptomeninges. Okay, this is your neural crest derivatives. Very, very important. Okay. Now going to the next topic, you see a jump from one topic to the other. The next topic is the quadrangular and the triangular spaces and the triangular interval. What is the triangular interval? The lower space. So now what do I want you to do is try doing it on yourself. Then you will understand this better. So basically remember this by the hashtag thing. So you have this, make this 2 fingers and these 2 fingers like this. So you can see this one is gonna be your quadrangular space. You have the upper triangle space and you have the lower triangle space. Are you guys able to see that, right? So this quadrangular space, this is like this. The quadrangular space is the one which is going towards the axilla. Okay, the quadrangular space is the one. So basically your two fingers like this and two fingers like this. Okay, that is how it is. Okay, this is how your quadrangular space is made. This is the upper triangular space and this is the lower triangular space, which is called as triangular interval. So this is towards the axilla. Okay, so this one is towards the axilla. So this quadrangular space is the one which will contain your axilla. So basically your axillary nerve is the content. Okay. Now what are these structures that you have here? So if I put this hashtag here towards the axilla, this vertical line that we see here, okay, this vertical line that we see here, this is basically humerus. Okay, this is humerus. These two muscles that we see here, okay, these horizontal muscles, these are the teres muscles. Okay, these are the teres muscles. So which teres muscle is upper? It is your teres minor and then you have the teres major below. So look at this muscle. Okay, this muscle basically, let me do this here. So this muscle, yesterday we saw in cadaveric images, supraspinatus, infraspinatus, close to infraspinatus you have teres minor and the below one is your teres major. This lateral is your humerus and this is the triceps. Okay, this muscle here is the triceps. What head of triceps? The long head of triceps. Okay, so this quadrangular space here going towards the axilla, it contains your axillary nerve and the posterior circumflex humeral artery. Okay, the posterior circumflex humeral artery. Then you have the next one, this triangular interval, that is the lower triangular space. It's near the shaft of the humerus. You know the nerve which curves around the shaft, the radial groove, that's the radial nerve and you have the brachial artery. Now what remains here? This upper triangular space. It is towards the scapula, right? It is towards the scapula. So it is your circumflex scapular artery. Okay, only the vessel, not the nerve. The circumflex scapular artery. So again, revising it here, what did we learn is this quadrangular space is the axillary nerve and the posterior circumflex humeral artery. This one, which is towards the humerus shaft, the lower one, that is the radial nerve along the shaft of humerus, and you have the brachial artery, right? The brachial artery. This one, which is towards the scapula, right? So this one is going to contain circumflex scapular artery. Okay, it will contain circumflex scapular artery. Is this clear with everyone? The boundaries and the contents basically. Okay, the boundaries and the contents. So this boundary which you see here, this is the long head of triceps. This one is the humerus. The above one is the teres minor and the below one is the teres major. Okay, that is teres major. Everybody, before we go to the next topic, quick thumbs up that you are clear with this. No doubts in whatever we have discussed. Yes, everybody is clear with this. Where does teres minor insert and where does teres major insert? Teres minor and teres major, where do they go and insert? Okay. Teres minor inserts, it's a supraspinatus, infraspinatus, teres minor rotator cuff muscle. It goes to the greater tuberosity. Teres major, lady between two majors, right? You have lady between two majors. So latissimus dorsi in the floor of the intertubercular sulcus. Then you have the two majors, the medial lip and the lateral lip of the intertubercular sulcus. Lateral lip is the one which has pectoralis major. Remember, pectoralis is the lateral lip. Medial lip is gonna be your teres major. Okay, the medial will be the teres major. Okay. So this is about the quadrangular space and the triangular space. Someone of you had asked in the 5 p.m. class. So that's the reason I have covered here. Okay, I hope this is clear now. Next topic, coming to the topic of cubital fossa. Okay, coming to the topic of cubital fossa, how do you identify the structures, which is the medial aspect and which is the lateral aspect? Now, first, the boundaries of the cubital fossa. So, in the cubital fossa, anatomy, the best way to learn is by doing it on yourself. So, when you see the cubital fossa, the muscle which comes, okay, the muscle which basically comes from medial going to lateral like this that is your pronator teres muscle, not pronator quadratus. Pronator quadratus is here, the deep muscle at the wrist, okay, the distal forearm. So you have pronator teres and you have your brachioradialis, which form the boundaries. So you have this, basically the pronator teres which will come, and you have brachioradialis. And the content from medial to lateral is your MBBR, right? It is MBBR is the content. So you have the median nerve, you have the brachial artery, you have the biceps, and you have your radial nerve. Okay, then you have the radial nerve. So look at this. The important thing is how will you identify which is the medial and which is the lateral. If you see on yourself, the medial one is more prominent. So whatever is more prominent, it comes like an angle, a sharp pointed thing. That is the medial epicondyle. So if you start from there, this is going to be M. So this is the median nerve, right? You see here. Let me zoom this image for you. Okay. So this one is going to be the median nerve. Okay, that's the median nerve. Adjacent to that is your brachial artery, right? That's the brachial artery. You can see that it's dividing into your radial and ulnar. That is another clue to identify. This is the brachial artery. Then you have the bicipital aponeurosis, and here you would have the radial nerve. Okay, here you would have the radial nerve. Okay, so these are the cubital fossa contents. Remember, pronator teres and brachioradialis. Right, where does brachioradialis go and inserts? Brachioradialis inserts on the radial styloid process. What is the nerve supply? Radialis is supplied by the radial nerve. It is a muscle of the extensor compartment of the forearm. Okay. Another image, cadaveric image, cubital fossa. Again, the one which is more prominent, that is going to be the medial aspect. That is how you will identify. And the straight one is your lateral side. So on the medial side, the first content that you have, that is going to be the median nerve. Then you'll have the brachial artery. Okay, that is how you would identify. All right. Now look at this one. And now if I ask you, identify the structure labeled 24. What is the structure labeled 24? What structure is that? What is the structure labeled 24? This structure? Trace it down, trace it down, trace it down, and you can see it's dividing into two. It is dividing into two. This one. Right, so that's a brachial artery. Okay, that's a brachial artery dividing into two. This is the median nerve. This is your medial epicondyle, bicipital, and this is going to be your radial nerve. Okay, that is going to be the radial nerve. All right. So done with cubital fossa. Okay, done with cubital fossa. Now coming to the next one, popliteal fossa we had seen yesterday, right? I hope all of you remember the popliteal fossa, the diamond-shaped structure. Right in the middle, you will have tibial nerve, lateral aspect, common peroneal nerve. What muscle is there? Lateral aspect, the biceps femoris, right? Medially, you have semi-semi, semi-semi, semi-membranosus, semi-tendinosus, right? So I hope you remember that. Now, identify this muscle. If you are given an image like this and you are asked to identify this muscle, how will you identify the muscle basically? Now, this is the dorsal aspect. You can see the bones. The metacarpals will be concave towards the palm. So, this is not concave, this is straight. This is the dorsal aspect, extensor aspect. You can see that the muscle is going towards the, where is this muscle going? Metacarpal, right? You have the proximal phalanx and the distal phalanx. Now, the one muscle here related to the thumb, the extensor aspect, attached to the metacarpal, that is your APL. Okay, that's your APL. So very, very important that I want you to remember that in the muscles of the thumb, okay, in the muscles of the thumb. So if this is the metacarpal, this is the proximal phalanx, this is the distal phalanx. The muscle which is attached to the metacarpal, that is your abductor pollicis longus. The one which is attached to the proximal phalanx and the one which is attached to the distal phalanx. Which one will be attached to the distal phalanx? Extensor pollicis longus or extensor pollicis brevis? It would be longus, right? Longus will be long. It will go till the distal aspect. Extensor pollicis brevis would be on the proximal phalanx. So remember, basically your extensor muscles on the phalanx, abductor muscle on the metacarpal. Okay, abductor is on the metacarpal. Extensor is on the phalanx. Okay. Now, let me just see that. Okay. So identify this muscle. Now I'm basically coming to your anatomical snuff box. Another query that was asked in the 5 p.m. class, how to remember the anatomical snuff box boundaries. So again, do it on yourself. Okay, do it on yourself, the anatomical snuff box. So you will see the lateral boundary. There is one tendon. Okay, laterally, yesterday also we saw lateral में सबसे बाहर you have your abductor muscle which comes. Okay, the abductor muscle is on the lateral side. So you have abductor pollicis longus. Okay, you have abductor pollicis longus. Now, two longus cannot go together. Remember, like two like-minded people, generally they do not go together. It is said that opposites attract. So, along with abductor, it is going to be your extensor pollicis brevis. Okay. It is APL and EPB, which is the lateral boundary. The medial boundary is the remaining muscle, which is the EPL. Look at the image here. Okay, look at the image here. So this is your सबसे outermost metacarpal को attach. That will be your APL. The next muscle close to it, which is going to the proximal phalanx, that is your EPB. And then the medial boundary that is going to the distal phalanx, that is EPL. And you will see the anatomical snuff box here. So clear with everyone again? Right, so this is the anatomical snuff box basically here. And you have the APL, then you have the EPB, and then you have the EPL. Okay, that is the EPL. So APL, remember, inserts on the metacarpal. Okay, it inserts on the metacarpal. Right, now look at these muscles. If I ask you to identify the muscle which is labeled, okay, the muscle which is labeled 4 here. What is this muscle labeled 4 here? Apply the knowledge or to the cadaveric images basically. So this muscle, you can see here, muscle label 4 forming the medial boundary of the anatomical snuff box. That's going to be your EPL. Okay, that is going to be your EPL. You will have the abductor pollicis and you will have the EPB going together. Muscles labeled 2 and 3 and the 4 is your EPL. Okay, the 4 is your EPL. Amazing. Okay, going to the next topic, anatomical snuff box done. So we have seen basically your neural crest cell derivatives, the spaces here, the quadrangular and the triangular spaces. And we have seen your cubital fossa, right? And we have seen the anatomical snuff box. Coming to the next topic, the foramen of the skull. Quick review of the foramen of the skull. Identify this foramen. What foramen is this? What do you think is this foramen? Is it jugular foramen or is it your internal auditory meatus or is it your hypoglossal canal? What do you think is that? Jugular, absolutely right. Now, how do you identify it is jugular? Please do not confuse it with the internal auditory meatus. The internal auditory meatus is not at the junction of your petrous bone and the occipital bone. It is in the petrous bone itself. Okay, so Arun, it's in the petrous bone itself. So internal auditory meatus will be somewhere here at the junction. Okay, at the junction of the two bones is your jugular foramen. And this one फोरामेन मैग्नम, इसके एस्पेक्ट पे जो यहाँ पे है, that is the hypoglossal canal. Okay, that's your hypoglossal canal. This large foramen that you see here, what foramen is this? What is this large foramen? The prominent foramen, oval shape, that is your oval. Okay. The mnemonic here, from anterior to posterior, it is frost. Okay, remember frost bite. So you have the superior orbital fissure, you have foramen rotundum, we have foramen oval, and then we will have foramen spinosum. So the one which is very prominent, that is your that is oval. Okay, that is the oval. All right. So this is foramen oval. What goes through foramen oval? We all know it is male. Male is a man. So remember, it is mandibular nerve. Okay, it is mandibular nerve. Through your F, it is your first branch of trigeminal, right? Ophthalmic. Through the second rotundum, it is your second branch maxillary. Remember, through foramen rotundum, it is your maxillary nerve. So when you say FRO, it is your ophthalmic, maxillary, and mandibular. Okay, 1, 2, 3. Then you have foramen spinosum. Spine is in the middle. So remember, it is middle meningeal artery. Okay, middle meningeal artery, which causes EDH if it is rupturing. And this is jugular foramen. What cranial nerves pass through jugular foramen? Cranial nerves 9, 10, 11. Okay, not the cranial nerve 12. 12 is your hypoglossal canal. 9, 10, 11, even in 11, remember it is the cranial root of the 11th, right? That is the descending root which is going down. Okay, so that is the descending root. Okay, that's your descending root. All right. Lacerum is here medial to the oval. That is where you have the lacerum. Basically, through that you will have the internal carotid artery which is passing over it. Okay. Okay. Now going to the next one. Okay, this is your skull foramina. Very, very important. Next, what do you think is the answer to this? We are talking about the tongue nerve supply, another important topic. Taste sensation from the anterior 2/3 of the tongue is carried by which of the following? Taste sensation from anterior 2/3 tongue is carried by which of the following? Yes, it is your seventh nerve. Okay, it is your seventh nerve. Now, easy to remember here. Basically, can you tell me your taste sensation comes in your which column of the cranial nerve? It is what column of the cranial nerve? Basically, is it general somatic efferent, special somatic afferent, special visceral afferent? Taste comes in which column? Taste comes in which column? How do you say it is efferent, guys? सबसे पहले it is a taste sensation. It is sensation which is being carried, right? So it is your afferent, not the efferent. First thing to remember, please don't make that silly mistake there. Second, it is a special sensation. It is not a general sensation, right? It comes in your special senses. So it is special afferent. And I've told you the trick to remember that taste, tongue is inside. It is covered within everything, right? It is covered. So remember, it's inside like an organ or like an viscera. It is special visceral afferent. Okay, it is special visceral afferent. And you have the nucleus, which is nucleus tractus solitarius. Nucleus tractus solitarius, what are the nerves? NTS is 9, 10, 7. Okay, it is 9, 10, 7. So if you arrange it from front to back, it is your 7, 9, 10 from the tongue. The taste sensation, anterior 2/3, posterior 1/3, and you have the posterior most, right? So 7, 9, 10. So anterior 2/3 is 7. Now if I ask you the question that what nerve carries the general sensation from the anterior 2/3 tongue? General sensation is carried by? General sensation is carried by the fifth nerve. Why is that so? You have 5 and 7 here. Because basically the anterior 2/3 that is developing from the first arch. Ninth is your third arch, and then you will have the fourth arch. 10th. Remember that the second arch does not contribute to the tongue development. Okay, the second does not contribute. 5 and 7, the nerves, basically the first branchial arch, it has your pre-traumatic, post-traumatic. So you have 7 and 5. That is why you have these nerves 7 and 5. Okay. So remember this, very, very important. Anterior two-third of tongue, except the circumvallate papillae. If it is asking for circumvallate papillae, it is along with posterior one-third of tongue. So the nerve carrying general sensation, it is your cranial nerve 5, that is the lingual branch of the fifth. And taste sensation is your facial, glossopharyngeal and internal laryngeal, right? Facial ka chorda tympani branch. This is all 9 and 10. So this is basically the first arch, and that is why you have this nerve supply, that is 5 and 7. Okay, that is 5 and 7. Pre-traumatic facial, and you have the post-traumatic, which is the fifth nerve. Okay. Is this clear with everyone? So please remember that the branchial arches contributing to tongue is your 1, 3, 4. It is not the second. Okay, it's not the second. And in the KBMD today we discussed all muscles of the tongue are supplied by hypoglossal nerve. Why hypoglossal nerve? Because the muscles of tongue develop from your somites, right? The occipital somites. So all muscles of the tongue are supplied by hypoglossal nerve, except to which muscle? We said this muscle is being shared by the palate also, another organ. So that is palatoglossus. Okay, that is palatoglossus. Okay, quick thumbs up everyone. Done with the next topic. That is tongue, right? That is the innervation of the tongue. Very, very important. Okay, it's very, very important. Arushi, genioglossus nahi, palatoglossus. Okay. So this is what it is, the diagram basically. So you have 7, 9 and 10. The taste sensation, general sensation is 5, 3. That is lingual branch. And you have 9 and 10. Okay. You have the arch 1, 3 and 4 contributing. Okay. Arch 1, 3 and 4 contributing. Next one, I will quickly tell you, if you have not seen the session of branchial arch derivatives, let us quickly revise this. The derivatives of the branchial arches, the branchial apparatus basically. Now remember that the first is the arch of M. So you have mandible, you have malleus and you have Meckel's cartilage. Along with malleus there is incus, stapes is not from first, stapes is second, S for second. Then you have the nerves also, you can remember the odd numbers. What are the odd numbers basically? Start with 5, 7, 9 and then you have 10 and 10. It is the fifth branchial apparatus which regresses. Remember 5 has no life. Then you have the second, which is 7th. It is your stylohyoid ligament. Stapes but not the foot plate. Okay, foot plate develops from otic capsule. Development of the hyoid bone. Very easy to remember the development of hyoid. So basically the hyoid is like this. Okay, the hyoid is like this. It has the greater cornu. It has the, did I draw this wrong? Okay, so this is how you have the hyoid. You have the lesser cornu, the greater cornu and you have the body. Okay, so remember that SSS, that is SSS, that is the small cornu. That is the superior half of the body of the hyoid. These develop from the second arch. So basically this part which you have here, okay. So this part which you have here, the small cornu and the superior half, this is the second. The remaining which is there, okay, the remaining which is there, this one, that is the greater cornu and the inferior half, that is the third. So remember hyoid basically develops from second and third arch. Okay, it develops from second and third. Is this clear with everyone? Okay, so if you remember this with the schematic diagram and remember this mnemonic, that is basically your SSS, the small cornu, superior body is second. So look at this one here, lesser cornu, that is the small cornu, and the upper body, that is the superior body, it is from second. Lower body of hyoid, greater cornu of hyoid, it is from the third. Thyroid cartilage develops from the fourth, rest of the laryngeal cartilages is from the sixth. Which is the muscles? Let's have a look at the muscles. We'll see the muscles also. In the artery, first is maxillary, second is stapedial. Remember, C is the third alphabet. The third ka artery is carotid. Arch of aorta, arch has four alphabets. It is the fourth arch. Which fourth? It is the left fourth because aorta is present on left. And please remember, it is the right subclavian artery, not the left subclavian artery. Okay, the left is the arch, the right is the subclavian. Then you have the pulmonary artery. Draw the lungs like this, which shows the number 6. So pulmonary artery is from 6. And then you have the ductus arteriosus connecting pulmonary to aorta on the left side. It is your left sixth arch. Okay, the left sixth arch, which is your ductus arteriosus. Okay. What are the nerves? We have already seen the nerves. Some quick revision of your muscles which are important. Okay, the quick revision of the muscles which are important. So in the digastric muscle, okay, in the digastric muscle, anterior belly, posterior belly. Anterior belly is your first arch. So the nerve supply is fifth, right? That's the nerve of the first. Posterior belly is the second arch. So the nerve supply is facial. Okay, the nerve supply is facial. The next one, which is the only muscle of the third arch, which is the only muscle of the third arch. Third arch is your ninth cranial nerve, glossopharyngeal. It supplies your stylopharyngeus, right? We discussed today. Pharynx ka muscle, which is stylo, does not want the common nerve supply. Like the rest of the pharyngeal muscles, stylopharyngeus. Which laryngeal muscle is the muscle of the fourth arch developing from fourth? Cricothyroid, because it is supplied by superior laryngeal nerve, the external laryngeal nerve, which is the motor component. Okay, which is the motor component. So remember all of this, very, very important. The muscles of the first arch are MAT. Again, M. It is M2A, T2. Mylohyoid, muscles of mastication, anterior digastric, tensor tympani, tensor villi palatini. Okay, these are the muscles of the first arch. Okay. All right, let's go to the next one. Cadaveric image. Identify this muscle. What do you think is this muscle here? What do you think is the muscle there? So yes, this muscle is piriformis. Okay, this triangular muscle that you have here, this is piriformis, and it will go towards, where does it insert? On the greater trochanter. Okay, when you see this triangular muscle beneath the gluteal muscles, it is piriformis, goes towards the greater trochanter. So if I ask you, what is this artery here? Above the piriformis, superior gluteal artery, right? Below the piriformis, it is your inferior gluteal artery. So now tell me, superior gluteal artery, inferior gluteal artery, what are they branches of? Superior gluteal artery, inferior gluteal artery, what are they branches of? These are the branches of internal iliac artery, right? These are the branches of internal iliac artery. There's the mnemonic for the branches of internal iliac artery, right? What is the mnemonic for the internal iliac artery branches? Internal iliac artery, you have the anterior division, you have the posterior division. Remember ant, anterior ant, and remember the another animal, that is mouse. So remember your mousey. Okay, ant and mousey, that is mousey. So you have the arteries here, which is inferior gluteal artery basically, right? Mousey, absolutely right. So you have the middle rectal, you have obturator, you have your uterine, you have a superior vesicle, right? And what do you have here? The next one. The internal pudendal inferior gluteal artery. From the posterior, right? Remember posterior pils, that is you have iliolumbar, lateral sacral, and S stands for superior gluteal artery. So remember that superior, when I write, it has P in its spelling. So that is the posterior division. So remember, superior gluteal artery is from the posterior division of the internal iliac artery. Inferior is from the anterior. Okay, inferior is from the anterior. Okay. Next one, look at this, the labeled one. This thickest nerve that you see here, it is the sciatic nerve. Okay, the thickest one is the sciatic nerve here. Okay, adjacent to that would be your posterior cutaneous nerve of thigh. Okay, the posterior cutaneous nerve of thigh. Okay, going to the next one. I hope all of you know this. The root value of musculocutaneous nerve, our favorite mnemonic for the brachial plexus. What is the favorite mnemonic for the brachial plexus? 3 long musketeers assassinated, right? 3 long musketeers assassinated, 5 rats, 5 mice, and 2 unicorn, right? So L is your lateral sacral. So 3 long musketeers. Remember, brachial plexus is the 5 roots. See 5 roots start from 5. 5, 6, 7, 8, T1. 3 long, the first 3, 5, 6, 7. That is your, so the first 3, that is C5, 6, 7. It is the long thoracic nerve. Musketeers is your musculocutaneous nerve. Okay. Assassinated is like this. You assassinated. So like the gun, imagine assassinating. So this is 2 roots, C5 and C6. Okay. And assassinated is your ax, that is your axillary nerve, C5, C6. 5 rats, 5 mice, that is radial nerve and the median nerve. It is all the 5 roots values, C5 to T1. 2 unicorn is the last 2, that is ulnar nerve, C8 and T1. That is the last. Okay, that is the last one. Okay. So that is what is your root values. Very, very important. Musculocutaneous nerve. 3 long musketeers. So 5, 6, 7. Okay, this is your 5, 6, 7. Some quick points about musculocutaneous nerve. Let us quickly revise. Musculocutaneous nerve arises from the lateral cord of the brachial plexus, right? It pierces your which muscle? Coracobrachialis. It pierces coracobrachialis. How does it end? What is the terminal branch? How does it end? It ends as the lateral cutaneous nerve of forearm. Your recent NEET PG 21 question. The lateral cutaneous nerve of forearm. What are the muscles it supplies? BBC, the anterior compartment of the arm. What is BBC? It is biceps brachii. You have brachialis and coracobrachialis. Remember, it is not brachioradialis. Brachioradialis is by the radial nerve. Okay, it is by the radial nerve. So that is about your musculocutaneous nerve. Is it a motor nerve, a sensory nerve, or a mixed nerve? It is musculocutaneous, supplying the muscles BBC, cutaneous, lateral cutaneous nerve of forearm. So basically, it's a mixed nerve, right? It's a mixed nerve. Remember all of this. Next one. Okay, let's go to the hypothalamic nuclei now. Quick revision of the hypothalamic nucleus. The hypothalamic nucleus, which controls circadian rhythm, is which of the following? Which is the hypothalamic nucleus which controls circadian rhythm? Yes, that is the suprachiasmatic nucleus. So remember, this circadian CI is your CHI, that is your suprachiasmatic nucleus. Okay, tell me the functions of rest of these. Supraoptic, paraventricular, and anterior. What is the function of supraoptic? What is the function of supraoptic? Yes. So remember, supraoptic and paraventricular. Okay. So remember, O is for V, and V is for O. That is basically the supraoptic nucleus is for V, that is vasopressin, okay, and your paraventricular nucleus is for oxytocin, okay, that is for oxytocin. Remember it like this: O for V and V for O, okay, very, very important. Anterior nucleus, what is the anterior nucleus does? Vasopressin is basically your ADH, okay. Anterior nucleus, is it response to cold, response to heat? What does it do? Anterior, remember it is response to heat. Okay, heat you write as A-N-T rather as H-E-A-T, write as A-N-T. It is response to heat. A-C, when you are responding to heat, it is hot. You switch on the AC. So remember, basically it cools down. It decreases the temperature. It is response to heat, but that means it is decreasing the temperature. It is your posterior nucleus which is response to cold, PO, and cold, CO, and it increases the temperature. Okay, it increases the temperature. Now, which is your satiety wala nucleus? Satiety is lateral nucleus or the medial nucleus? Satiety is the lateral or the medial? See, now imagine, do it on yourself. You know, many mnemonics, if you do it on yourself, you remember better. So imagine you eating from this side, that is the lateral side. And when your stomach, your tummy is full and you don't want to eat, that means you have reached your satiety. So, you know, that is how you will be eating, so that you'll eat slow. You do not want much. So you'll eat slowly like this, you know, like this from the medial aspect. So that's your satiety. So remember, lateral is eating. It is your hunger and thirst, and the medial is basically your satiety. Okay, so look at these ones. Let's quickly see. Supraoptic, O is for V. Paraventricular, V is for O. Okay, anterior is your response to heat. It decreases the temperature. Posterior is response to cold. Lateral initiates the eating, that is your hunger and thirst center. Medial is your satiety center. Suprachiasmatic, that is your circadian rhythm. Okay, that's your circadian rhythm. Okay? Clear with everyone? Okay. Next one. Coming to the quick revision, we have seen this, but this is what we have not seen recently. Anterior choroidal artery is a branch of which of the following? Anterior choroidal artery is a branch of? It's a branch of ACA, ICA, MCA, or PCA. Right. Majority of you are right. Very good. It's a branch of ICA. Remember, anterior choroidal, AC is a branch of IC. Okay, AC is a branch of IC. So anterior choroidal is a branch of internal carotid. Okay, it's a branch of internal carotid. So you have internal carotid, which divides into MCA and the ACA. Just before dividing into the MCA and the ACA, the branch which it gives, it is the anterior choroidal artery. Okay, that's your anterior choroidal artery. And what does it supply, this anterior choroidal artery, in your internal capsule? If you have anterior choroidal infarct, where will you see the restricted diffusion? Where will you see the restricted diffusion? What part of the internal capsule classically you would see that it is affected? Anterior choroidal artery infarct. Very good. It is your posterior limb. Okay, it is the posterior limb that will be affected. Remember, it's a posterior limb of internal capsule. All right. Your anterior limb of internal capsule, it has a blood supply from the recurrent artery of Huebner. Okay, the recurrent artery of Huebner supplies your anterior limb. Okay, that is what supplies your anterior limb. Okay. Next one, this we have seen, so not revising, just a quick review. Not a branch of basilar artery is your pica. Pica is a branch of vertebral artery, basically affected in your Wallenberg syndrome. Okay, that's your Wallenberg syndrome. So these are the branches that you can see here. If you get the schematic diagram like this, so look at the branches here. So the internal carotid, which gives your middle cerebral and anterior cerebral. Here you have the anterior choroidal. This is the posterior communicating, also coming from internal carotid, and you have the ophthalmic. Okay, remember the branches: ophthalmic, anterior choroidal, and this is your posterior communicating, all from the internal carotid. Terminal branch of basilar, that is the PCA. Just below that is the superior cerebellar. Lower part is your ICA. Vertebral gives your pica. Okay, vertebral gives your pica. Okay. This we have seen in the yesterday's class, the cranial nerves, cadaveric images, YouTube class, we have seen this already. Okay. Coming to this one, basically your medulla ka cross section. How will you identify that this is a cross section of the medulla? By looking at this classical thing, the wavy sort of thing that you are seeing here. What is this? This is the inferior olivary nucleus. Okay, basically this one is your inferior olivary nucleus, the olive, and this one is your pyramid. Okay, this one will basically be your pyramid. This is the olive. This is the anterior part here. This is the posterior. Behind the medulla, basically your fourth ventricle, which will come here. Here you will have the fourth ventricle. Okay, here you would have the fourth ventricle. Is this clear with everyone? Now, where is the hypoglossal nucleus, the fourth ventricle rhomboid fossa? The medial one, this is going to be your hypoglossal nucleus. Okay, that is where you would have the hypoglossal nucleus, which is located there. Is that clear with everyone? Okay, so the medial one, hypoglossal is the medial nerve in the medulla. So remember, that is medially located. Okay, that is medially located. All right. This is your inferior olivary, and cadaveric image, we have seen that yesterday already, right? This also we have seen in the today's class. This we saw yesterday and today also. Ansa cervicalis does not supply your geniohyoid and thyrohyoid. Types of joints in the upper limb, a quick review. I'll start with the elbow. Shoulder we know is a ball and socket. In the elbow joint, because here you have a mnemonic to remember the palindrome mnemonic, that is H-E-E-H. Okay, I'll start with the elbow. So it is your hinge joint. Then is the wrist joint, which is ellipsoid. The next joint comes is your metacarpophalangeal. Again, it is ellipsoid. And then you have the interphalangeal, which is hinge. So if I start with the elbow joint, hinge, then you have the wrist joint, then you have the metacarpophalangeal, and then you have the interphalangeal. So look at this one. Elbow is a hinge joint. Then you have your wrist joint, which is ellipsoid, HE, metacarpophalangeal, ellipsoid, and your interphalangeal is hinge. So remember H-E-E-H. Okay, H-E-E-H. Sternoclavicular joint, SS, it is a saddle joint. So remember, sternoclavicular is a saddle joint. Acromioclavicular, the joint that is your plain joint. Okay, acromioclavicular is a plain joint. These joints, the radioulnar joints, superior and inferior is where you do the pronation and supination, the rotation wala. So that is your pivot joint. Middle is the syndesmosis, right? You have the interosseous membrane. It's a fibrous joint, syndesmosis. Very, very important, first CMC joint, which is involved in osteoarthritis. It is a saddle joint again. Okay, it's a saddle joint. So you have two saddle joints, sternoclavicular and the first CMC. Okay, they are the saddle joint. Remember all of this, very, very important. Okay. Okay. Next one. All of the following muscles are supplied by tibial nerve, except, what do you think would be the answer to this? CBT question? Okay, that's great. All of the following muscles are supplied by tibial nerve except? Think logically and tell me what would be the answer here. Very good. Madwin, Weber, Richa, I can see you answered that. Amazing. See, yesterday only we discussed that in the leg, the tibial nerve basically is the nerve of the posterior compartment, right? So it is your posterior muscle that will be supplied by your tibial nerve. Okay. So flexor, the posterior compartment is your flexor compartment, continuous with the sole. Flexor, yes. Popliteus is a deep posterior muscle. Tibialis anterior, it is your tibialis anterior. Tibialis anterior, it's your anterior compartment, deep peroneal nerve, right? That would be your deep peroneal nerve. Remember the exception we saw yesterday? Even though it is supplied by peroneal, but because it's a tibial muscle, what is the function of tibialis anterior? It causes inversion, not eversion. Okay? All right. This we have seen a similar sort of image basically. If this is given as the superior vena cava, what is the structure labeled A and what is the structure labeled B? How will you identify A and B? If this is the superior vena cava, what is A and what is B? Remember SAP, from right to left, SAP is basically your superior vena cava, ascending aorta and the pulmonary artery. Okay. So the A will be your ascending aorta and the B would be the pulmonary artery. Yesterday we saw that pulmonary artery left branch, last and Rath. The left artery is superior to bronchus. The right artery is anterior to bronchus. That's why the left hilum is higher on the chest X-ray. Okay. This is your CT correlate of what you have seen. So the three vessels that you see here, basically from right to left, that is your SAP. Okay, you can remember this as SAP, that is the snake. So you have SAP, that is your superior vena cava, ascending aorta and the pulmonary trunk going into the right and the left. Okay, the right and the left. All right, so this is your three vessels. Very, very important. Okay. This is done. Brachial plexus. We have done this many times. Just if I ask you this one question in the brachial plexus. Okay, if I ask you this question. Identify the nerve labeled 18 and the nerve labeled 1. You can see these two nerves here. Identify the nerve labeled 18 and the nerve labeled 1. What are these nerves? 18, 1 and 21. What are these nerves here? It was this mnemonic only, Arushi. That is SAP basically. '18 is musculocutaneous. Okay. Good. Okay. 18 ulnar nahi hoga, right? Yes, Purnima. So yes, it is your. Look at this. I've told you to identify these brachial plexus by the M. Most important, easiest to identify in the middle that you have contribution from the two cords. That is your median nerve. So number 17 is your median nerve basically. Then you have the other nerve here coming from the lateral cord, the upper one piercing the coracobrachialis. That would be musculocutaneous. The medial one here, that would be the ulnar nerve. Ulnar is on the medial aspect. So the three nerves are done, musculocutaneous, median and the ulnar. The next which are left in your terminal branches. How many terminal branches from brachial plexus? The 5 terminal branches. That is your marmu or mamru that you can remember. So musculocutaneous, axillary, radial, median and ulnar. So where is the radial and the axillary? Posterior cord. Both of them are from the posterior cord. So this nerve below the musculocutaneous going into the axilla, the quadrangular space where it will go, axillary nerve. So musculocutaneous ke saath is your axillary. MA, you have your M median nerve. Posterior cord 21 going down, that is 21 wala nerve, that's your radial nerve, and this is your ulnar nerve. Remember the 5 branches. Musculocutaneous pierces the muscle, axillary goes into the space. M, A, RMU. Okay, that is how you would be identifying. If you want, I'll zoom this image and show this, all of this again to you. Now, can you identify this? Can you see this? So you have this from the lateral cord. This is the branch coming. Lateral cord contributing to the median nerve. Medial cord, lateral cord, median nerve. This is the musculocutaneous. This is the axillary going into the space, into the axilla. Posterior cord here, the biggest nerve here, posterior cord. Behind the median you would see, that is your radial nerve it would be. And this one, the medial cord forming the medial aspect of M, 26 number, that is your ulnar nerve. Okay, that's your ulnar nerve. Okay? All right. So again, I think now you would be able to identify here in these images the branches. Right? Can you identify the branches now here? So see, look at the 5 branches basically. This is your lateral cord contributing to the median nerve. So coming from the lateral, this is lateral. How do you know it's contributing to median? That's why. This is the musculocutaneous. Below that, coming from the posterior cord is the axillary nerve. Posterior cord continuing down, this is the radial nerve. This is the median nerve, right? That's your median nerve. And then you would have the ulnar nerve. Okay, then you would have the ulnar nerve basically. Is this clear with everyone? All right. So these are basically the branches that we are seeing from the brachial plexus. Okay, these are the branches from the brachial plexus. Okay. Very last topic to be discussed here. I hope I have it. Do I not have it? Missed adding it here. Okay, no problem. The rest of it we have already discussed somewhere in the classes. All right. So what will we do is, it's already 10:15, 1 hour, more than 1 hour into the class basically. So we'll call it off for today, right, for anatomy revision, and we'll keep doing this revision, whatever is left. We'll do the sessions in between, right? There would be other sessions going on. Tomorrow would be orthopedics. I hope this has helped you at least in revising few topics of anatomy. This is like rapid revision for the last minute. So I hope you have found this helpful. If yes, please do not forget to share this with your friends and juniors also, because sharing is caring, right? So thank you so much, everyone. Functional columns, Aishwarya, the video is already there on the YouTube channel. On this channel itself, you can definitely watch that. Okay? All right. Thank you, everyone. I'll share the PDF on the group for after this class. I'll share the PDF on the Telegram group, Dr. Nikita's Radsynapse. Okay, I'll be sharing the PDF there. Okay. Thank you and goodbye. Take care and keep studying. Keep revising and keep winning. Internal iliac artery, just search in the Telegram channel whatever session you want. Like search the functional column, search internal iliac artery, you'll get the links there. Okay? Thank you. Goodbye and good night, everyone.